My name is Michael Robichaux. I was born and raised just half an acre north of where we are right now. I live in a little town called Raceland, Louisiana. I'm a physician. My father was a physician before me. And I'm an ear, nose, and throat doctor by training. Well, probably the first and original negative outcome was that a whole bunch of extremely sick people from Florida, Alabama, Mississippi, and Louisiana that had identical symptoms. They were significantly debilitated. There was no way for them to compare their symptoms. There was no way for them to be interconnected knowledge-wise or anything else. They just had illnesses that were very similar and problems that were similar. Many of them weren't able to work, and so they had no insurance, they had no resources, they lost their homes, they were having to sell their automobiles and all to get medical care, but none of the medical care was taking care of their problems and getting their problems better. So it was really a very frustrating and emotionally draining period of time. I had a man come in this week that I'd never seen before. And it was interesting because he didn't come in telling me anything about the spill. He was telling me about some of his illnesses and so forth and some problems that he had. And I asked him, well, why'd you come to me? Because you live in Venice. He said, well, because you've taken care of some of the people from the spill and none of our doctors understand what's going on with that. And then we went on to discuss the issue, and he had classic symptoms of what I call BP syndrome, the illnesses that I've been seeing since this problem began. I've taken the data from 112 patients that I saw, 113 patients that I saw very closely and worked with very closely. And the illness caused the following problems. The first thing that they had on the top of the list were headaches. A lot of these people had headaches, I think close to 90% of them. And then the other thing the next thing that was really the most dramatic of all the things was memory loss. Everybody came in with significant memory loss. And when you talk to the spouses about it and so forth, they said, just he doesn't remember anything. He can't, we have to put Post-it notes all over the place to remind him to do things, or he's got to write Post-it notes to remind himself to do things, or to go places, or buy this or do that, or whatever the case might be. Dizziness was a prominent symptom with a lot of these patients. And the dizziness was commonly associated with blood sugar problems, and we had a lot of people with low blood sugar and hypoglycemia. It was to such a degree that everybody that came in the program, I taught them how to graze, and that we had them on multiple little feedings during the day. And apparently this was part of the neuroendocrine symptoms that came on from whatever the toxins were that caused their illnesses and so forth. So it was really a fascinating time for me to be learning about these things. There was nothing to read on it. Nobody really understood it. There's one person that later on we may discuss who I later heard an article that or a video that he put out and so forth that understood exactly what was going on and described it. But that was later on, and I think we were almost through with our program by the time I heard his tape.